Hi, I'm Dr. Moshe Roth. I practice at Family Eye Care in Old Bridge, New Jersey. You can reach us at 732-679-2020. I'd like to discuss 6 reasons why scleral lenses can solve your dry eye syndrome. Many people, especially those that are over 50, suffer from dry eye. These patients complain that their eyes feel dry and itchy and irritated and gritty and scratchy, and some people complain that it feels like there's something in the eye. Eye drops and artificial tears can give you some temporary benefit and relief, but some people are bothered by the fact that they constantly have to put in these artificials to give them that relief. Some people don't feel that they get the relief that they're looking for even when they put these eye drops in. They only last for a short while. Many people who suffer from chronic dry eye look for other ways to get relief. Scleral lenses can help solve your dry eye. Scleral lenses are usually used to treat corneal problems that are due to disease like keratoconus, or people who've suffered from laser refractive procedure to correct refractive errors. Scleral lenses can also provide great relief to patients who have dry eye, and they do that because of several different reasons. 1, scleral lenses don't irritate the cornea, the front part of the eye, like other contact lenses do. For patients that require vision correction in addition to dry eye correction, scleral lenses offer a wide range of being able to personalize this for the individual. Soft contact lenses are often not a good choice for people who have dry eye. And often we have patients that have been used to wearing soft lenses and they keep wanting to continue with soft lenses, but actually the soft lenses makes their problem worse. Soft lenses sit right on the cornea, and that itself can be very irritating. A soft lens acts kind of like a sponge and draws moisture out of the eye. If you've ever seen a soft lens on a countertop that's dry, you can notice that it's dry and crinkly. And that's the reason why it feels uncomfortable, somewhat similar to having a sponge on a countertop. When it's moist, when it's full of water, it's floppy, but when it dries out, it gets dry and crinkly. And that's kind of like what happens to a soft lens. It loses water during the day, and that's why it makes a dry eye feel even worse. Those who have a dry eye find that wearing soft contact lenses is uncomfortable and visually unbearable. They can't wait to pull their lenses out after a day at work. Scleral lenses sit on the sclera, the white part of the eye, and they vault over the cornea. They don't touch the cornea at all. And that's why they're so comfortable. Number 2, scleral lenses create a dome over the cornea and they keep the cornea wet all day long. They create a space between the surface of the cornea, the front part of the eye, and the back surface of the lens, and that creates a space or a reservoir that's then filled with saline or with tears so that the eye is always kept moist. And this gives a lot of relief to people who have dry eye. If needed, we can even put antibiotics in the back surface of the lens. We call that the bowl to help the cornea heal. 3, scleral lenses protect the cornea. Dry eye syndrome leaves the cornea and the eyes more sensitive and the cornea is more vulnerable to eye injury. And even something as simple as blinking the eyelids can irritate the eye or even injure the cornea due to the mechanical friction of the eyelids on the cornea. Scleral lenses act as a shield, kind of like a band-aid between the patient's eye and their eyelids and the outside environment. This shield protects the eye from further irritation or damage. 4, scleral lenses allow the eyes to look healthier. People with dry eye syndrome often have eyes that look red and bloodshot. Some people are bothered by the fact that other people notice this and mention it to them. Hey, what's wrong with your eyes? They look all red. Were you out all night drinking? Okay. Scleral lenses act as a shield, protecting it from the outside world and giving it a healthier appearance. 5, you can still use eye drops and artificial tears to lubricate the eyes when wearing scleral lenses, but many people find that they no longer need to use the artificial tears as often as when they wear scleral lenses. 6. Scleral lenses can drastically improve your quality of life. Patients with dry eye feel pain and discomfort, redness, eye exhaustion due to severe eye redness. Scleral lenses do several things simultaneously. They provide vision correction while protecting the eye and lubricating the eye. We can even create these lenses as multifocal, meaning lenses that enable patients to be able to see off at a distance and up close. These factors improve your quality of life and the confidence that people feel when they have dry eye disease. Scleral lenses reduce pain and discomfort. The eyes are no longer red. They reduce the feeling of having to itch the eyes or the need to put in eye drops. Scleral lenses provide crisp and clear vision. If you struggle with dry eye syndrome and have been looking for a more effective treatment method than just eye drops and artificial tears, call us and ask us about scleral lenses. I'm Dr. Moshe Roth. I practice at Family Eye Care in Old Bridge, New Jersey. You can reach us at njeyesite.com or at 732-679-2020.